Usatine Media presents Wolverton's comprehensive dermatologic drug therapy app based on the third edition of the book. This is a great book for all practicing dermatologists. Everyone who does this on a day-to-day basis should have the Wolverton app or book at your hands. In fact, the beauty of having the app is that you can keep it on your iPhone, right in your pocket, and pull it out any office, any clinic space, and know exactly what you need to know immediately, right at the point of patient care. The app contains all of the materials in the book, every word, every diagram, every table. It's got systemic drugs, drugs for infectious diseases, immunomodulatory and anti-proliferative drugs, topical drugs, anything that you can imagine using in a dermatologic practice is here in this book. I love this myself, practicing a lot of dermatology. I'm constantly going here, pulling this out of my pocket to look up things like monitoring guidelines and other important issues when using some of these tough systemic drugs. For example, if we want to know more about dapsone, we could go here and we can jump around in the chapter. We don't need to scroll if we want to go straight to areas about clinical use. And here we are learning about the use of dapsone for dermatitis herpetiformis. There's also questions and answers that are embedded into the system, so you can use this as a Q&A. While we're here, we may want to bookmark dapsone and maybe go back to that later. If we look at the Q&A system here, if we hit Q&A, we can see these are questions that were designed for the dapsone chapter. And if we look at the first question and we want to see the answer in the text, all we need to do is click here. It shows you the answer, and if you go back to the Q&A or the questions, you'll see it's now turned green because that shows that you've already looked at that answer. And let's say you were going to go to the fourth question about typical timing of initial dapsone response and dapsone responsive dermatoses. And here we can see patients will respond within 24 to 36 hours of initiating dapsone. That's pretty fast. That's great. So we may want to, well, there's so many different ways to approach this. If we want to use our home button, we can go straight back to contents, or we can go straight to our search functionality. Let's say we want to search on methotrexate. We've already done that search, so it's kept it for us. We're just going to click on it, and here's our search for methotrexate, all the different times it appears in the text. Of course, the name appears many times in the methotrexate chapter, but it also occurs in the hematologic toxicity chapter, as methotrexate does have significant potential for hematologic toxicity. We can see images, diagrams, and there are tables as well. So that's the kind of search you can do. Let's say we want to start with a new search, and we're going to do something like azathioprine, which we know it's not so easy to spell. So let's try A-Z-A-T. Yep, there we go. We don't have to be able to spell the rest of it because it spells it for us. Click on azathioprine, see lots of matches in its own chapter, but also drug-induced malignancy, an important issue. With azathioprine, we might actually want to go there and see what kind of issues there are to be concerned about and risks to be aware of. Again, if we wanted, we could bookmark it, or we could even write a note. So we could make a note about something to do with malignancy, and we don't need to write a full note here, but just to show how easy it is to write a note and save it. Now, let's say we wanted to do something other than contents or search, we want to actually go straight to our Q&A, which we've done. So you can do it there and actually show you, we go to a specific chapter to do their Q&A, like systemic antibacterial agents. And we can also go and we can see our bookmarks. We've bookmarked a number of things at this point, and we can see which ones we've bookmarked. Very quickly get back to hepatotoxicity, which I bookmarked earlier while using this app. And we can look at our notes. And here was a note that we made about the methotrexate and liver biopsy. So we can go and cancel that. We've already seen that. And we can go back to our home through this mechanism. We could also go to learning about the app itself. At this point, we might want to see how to use the app if you have any questions about the navigation. We can also see how we can rate the app. We can learn about the authors, Dr. Wolverton, and where he is located, where he does his work. And finally, when we just want to learn a little bit about who developed this app, we can go to Develop By and see that this was developed by Usatine Media. I'm Dr. Usatine, working with Peter Erickson. Together, we've enjoyed creating these apps for you. And if you want to learn more about our other apps, you can go to usatinemedia.com. We, in fact, have many apps for the practicing dermatologist. Thank you, and I hope you enjoyed this preview.